We all know it's important to get a good night's rest, but many struggle to fall asleep, stay asleep, or just don't feel well rested in the morning. We're going to be talking about how you can improve your bedtime routine and the underlying condition that might be sabotaging your sleep. I'm Laura Wheatholder. I'm a registered nurse and community outreach coordinator for Blessing Health System. I'm joined today by Blessing Sleep Center Supervisor Suzanne Bogue. Suzanne, would you like to take a minute to introduce yourself?
Hi, my name is Suzanne Bogue. I am a registered respiratory therapist and a registered polysomnography technologist with the Blessing Health System. I have been a respiratory therapist for going on 17 years, and I have worked in sleep medicine for 10 of those years. I've been with the Sleep Center for the past 3 years.
Well, great. Thank you so much for joining us. Let's start with some basics. We all want a good night's sleep, but some of our habits might be interfering. How can we set ourselves up for a restful night?
It's important to keep a regular and consistent bedtime routine. Ideally, everyone should go to bed at the same time every night and wake up at the same time every morning, even on the weekends and on our days off. Before climbing in bed, follow a consistent routine that is done in the same order every night. For example, turn off the television, change into bedclothes, wash your face, take out your contacts, read for 15 minutes in that order every night. Having the same pattern every night helps your brain recognize that it's time for sleep. And after a bit of doing that routine, your brain will recognize what you're doing and actually release melatonin, which will help you fall asleep faster and sleep more soundly through the night.
So you'll start to release that melatonin even before you're laying down. So that's really good, really helpful advice. Thank you. So now I also understand our screen habits can affect our sleep. We all have smartphones. That could be impacting how restful of a night's sleep we're getting, right?
Absolutely. Our electronics release what's called blue light, and blue light affects the body's natural sleep and wake cycle. During the day, blue light wakes us up and stimulates us. In fact, sunlight is the biggest source of blue light that there is. But too much exposure from blue light in the evenings from our tablets and our phones interferes with the production of melatonin, and it stimulates the brain into being more awake and staying awake. Ideally, we should all be off of our electronic devices for a couple of hours before bedtime. But many electronics now also have nighttime settings that help minimize that blue light exposure.
So, at the very least, if you can't put the phone down for a good portion of time before bed, you should try to use that nighttime feature on your devices. All right.
Absolutely, yes.
More great advice. Now, beyond our own habits, there are some underlying conditions that could be sabotaging our sleep. Sleep apnea is a problem that affects millions. Can you tell us about sleep apnea?
Sure. There are different kinds of sleep apnea. The most common form of sleep apnea is obstructive sleep apnea, or OSA. And what that is, OSA is where the tongue and the soft tissue fall backwards when sleeping as the muscles begin to relax, and this blocks the airway. So a person who's sleeping tries to take a breath, but their airway is blocked and the air cannot get past the back of their throat. There's also central sleep apnea, and this is where the brain doesn't send the signal to the body that it needs to take a breath, and there's no effort at all. We do see this most often in patients who are taking certain sedatives or prescription painkillers, or patients who've had a stroke or brain injury.
Okay. What symptoms or warning signs might someone notice if they're struggling with sleep apnea?
A person who is suffering from untreated sleep apnea may suffer from excessive tiredness no matter how much sleep they get at night. They're tired during the day and often feel like they need to take a nap. Or if they sit down to watch TV or read, they'll fall asleep, may fall asleep while working at a computer or even driving. Sleep apnea keeps you from reaching those deep levels of sleep that are required for the brain and body to rest and reboot. This also leads to hormone imbalances, which can lead to blood sugar issues and weight retention. High blood pressure and AFib are other common symptoms that we see with sleep apnea. Every time you quit breathing, your body and your heart are deprived of oxygen. Think of it like depriving a car of gas. It just can't run without it. The heart works overtime without the appropriate fuel and it gets stressed, and this leads to high blood pressure and heart arrhythmias. It also greatly increases the chance of having a heart attack or a stroke if it's left untreated. We also have patients who complain of milder symptoms such as snoring, dry mouth, and morning headaches.
Wow, I love that analogy you gave, and it really does sound like sleep apnea, if not treated, can really lead to some very serious health effects. So, very important that people maybe seek treatment. And as you mentioned, it can be treated if it's successfully diagnosed, and the Blessing Sleep Center can help with that. Correct?
Yes. So the Blessing Sleep Center does sleep studies to diagnose and treat sleep apnea. We want to evaluate your breathing while you're sleeping and then pinpoint any issues that are there. We want to know how many times an hour somebody quits breathing, and then this lets us know how severe the sleep apnea is and helps guides us toward the proper treatment plan. The most effective treatment for sleep apnea is called CPAP, and this is a mask with a little bit of pressure that helps open the airways and keeps you breathing like you should. And this leads to less interruptions in your sleep and more restful and better quality sleep.
Great information there on the services that are available and how the Sleep Center can help. Is there anything else that you'd like to add to the conversation today about, how to get a well rested night's sleep, sleep apnea, or anything that we haven't covered today?
Well, mostly we want our patients to know that we are there for the whole process with them. If they're having issues with your sleep, if you're feeling tired or draggy all the time, talk to your primary care doctor about getting a sleep study done. We work with the doctor's office to get the appropriate test ordered. And if treatment is needed, we'll walk you through that process. Once you're started on therapy, we're always available to assist our patients if there's any issues. We want everyone to live their best life. We want to guide them in making the best decisions possible to keep them on the right track with their health.
Well, great. Thank you so much for joining us today. Lots of great information, and I think a lot of people could really benefit from a better understanding of maybe what's impacting their sleep. So, thank you so much. And for more information on how the Blessing Sleep Center can help you sleep easier and live better, log on to blessinghealth.org/sleep. Thank you.
Thank you.